Hi, I'm Dr. Darren Larson, Chief Medical Information Officer at Ontario MD. Ontario MD is collaborating with the College of Physicians and Surgeons of Ontario to provide CPSO assessors with training videos on how to review the electronic medical record. This video will demonstrate how a CPSO assessor can review relevant practice information while assessing a physician using PS Suite by Telus Health Solutions. In viewing this video, the assessor will become familiar with key components of the record that they are assessing.
This is a demonstration of Practice Solutions Suite EMR software from Telus Health, created for the purpose of producing an instructional video for CPSO assessors. This demonstration video is being recorded on an iMac computer. A PC screen will look slightly different. There is an assumption that the assessor will be accessing a computer with Practice Solutions Suite already open on the desktop, set to the login screen. Usually, the previous login user's name is listed, but the assessor will not enter using that username. They will find their own username. In this case, the user is CPSO assessor. A password would be supplied by the clinic, and it would be entered in this space. Having said that, for the purposes of this demonstration, I will be using my own sign-in and password. When the password is entered and the OK button is hit, the assessor is brought to the initial dashboard screen. The dashboard is for physician administrative use and contains a list of appointments, rostered patients, inpatients, current clients if the user is not a physician, the bill book, an address book for referrals, lists of handouts, messages, etc. In this situation, the assessor will not be using many of these functions, but will use the Patient Record tab. The list of charts to be assessed may be presented to the assessor in many ways. Some will start with a list of names on paper. To find each patient on the list, type Command or Control F, or choose from the menu bar. This brings up the Find Patient screen. Type in the appropriate surname and a list of available patients appears. Select the correct one. A second way to list patients is to create a list of appointments on a day that the physician is not present in the office. First, open the Appointments screen. To select a patient, click on the name and type Command or Control 1. This will bring you straight to the patient chart. A third method is to have patients preloaded by sending a message to the CPSO assessor identifying each chart. In this case, the assessor will use the Next Message tab to move from patient to patient. In this demo, we are going to be using a fake patient named Mickey Mouse. I will find the patient directly using the Command F key function and then simply type in the name Mouse. In this case, we have Mickey and Minnie Mouse to choose from. We're going to choose Mickey Mouse. When the patient has been chosen, this is how the screen appears. On this screen, the patient's clinical profile, or CPP, is immediately in view. For a view of demographics, one simply clicks on Mickey Mouse and the demographics screen will appear. The clinical profile is broken into different areas, as you are used to in the paper version. PROB is for current problem list, HPH is for past medical history, and REM is for reminders. You will note that there is an ability to click on the label for each of these fields to bring up more detailed information. For example, risk factors can be easily populated on a series of different indicators including alcohol, gambling, drugs, genetic issues, dietary issues, exercise, behavior, occupational exposures, and others. When clicking on the immunization label, the entire list of immunizations and the dates they were given is seen, and when minimized, simply the most recent vaccines. Medications can be visualized in a graphical format by clicking on the prescription header. In this case, past prescriptions and immunizations are listed above the line. Current medications are listed here as well. In a situation where there have been multiple repeats, these will show up with yellow hash marks at each one of the renewal dates. You can see this here for immunizations, which shows when flu shots were given at various points of time on this patient. In some offices, a toolbar may be present that lists preventative screening tests already done and when they are next due on the patient. This is not standard in every EMR installation, however. To see a larger view of a patient chart, hiding and showing the CPP is accomplished using the Command or Control W key. Command W will expand or collapse the patient profile. Show profile. View it, hide the profile. You can also use a table of contents to scan the chart using Shift-Command-T on a Mac or Shift-Control-T on a PC. In the table of contents, you will see a list of various items within the chart for quick reference. And as well, when hovered over, details of those entries will pop up. The table of contents can also be hidden in the same way. Everything in Practice Solutions software is accessed in a linear fashion chronologically over time, with the most recent entries at the bottom, and is viewed by clicking and scrolling. Or if using the table of contents, by clicking and moving to the appropriate spot in the chart. Hitting the image of a paperclip next to the note date opens any attached document. There is also the capacity of filtering the chart by moving to this view screen. One can show only notes produced by the user, only diagnostic imaging reports, only laboratory information, only notes from consultants, or all notes. This makes moving through Practice Solutions software and quickly accessing portions of the chart very, very easy. It's possible to show a graph or a table of all the laboratory results by working from the menu bar and choosing Show Lab Table, or typing Command-T on a Mac or Control-T on a PC. The lab table is cumulative over time and allows you to quickly reference laboratory results. To graphically view the lab table, one can also double-click on a value and bring up trended results. You will notice when hovering over the graph that dates and values pop up at the top, and medications on that date are shown at the bottom. Medication timelines were seen before, but they'll be shown again. Clicking on the medication list brings up the medicines as they were prescribed, or if accessing from View Fields, Treatment History produces a similar graph. Messaging is a large portion of Practice Solutions software. Messages are embedded in the EMR progress notes if they have been saved and not archived. Now I'm going to show an example of a flow sheet for chronic conditions. Flow sheets appear here. This is the list of the current flow sheets in this software instance. They exist for various chronic diseases such as congestive heart failure, diabetes, INR tracking, and other self-prepared flow sheets as created by individual clinics. They bring tables of results and notes into one spot. Screening is not always captured in one place in Practice Solutions software, and you may have to ask the provider where these are tracked, or look in the Reminder or Toolbar section of the CPP, or search the record, assuming that tests have been appropriately categorized. In this case, the assessor would choose and type in mammogram. This shows all notes containing the word mammogram, but by using the table of contents, one can quickly zero in on dates of the last mammogram and the results. The same can be said for colorectal screening, pap smears, and colonoscopies. When the assessor has completed his or her review of the patient chart, he will move on to the next chart by individually finding a patient from a list, using the appointment calendar, or hitting Next Message. When the assessment is over, the assessor exits by using the Close and Quit buttons.
This concludes our video demonstration for CPSO assessors using PS Suite by Telus Health Solutions to assess the electronic medical record. On behalf of Ontario MD and the College of Physicians and Surgeons of Ontario, we'd like to thank the CPSO assessors who provided us with guidance and feedback along the way, as well as Telus Health Solutions for assistance and permission to demonstrate their software in this video. Thanks for watching.